is the one. That would be amazing. So for those who don't know me, my name is Agnes Ronan. I'm the head of programs at PATA. And yeah, sadly, this is all coming to an end. It's always very exciting when we arrive, lots to look forward to. But now we have to say goodbye to each other. But I'm very happy because this is the first time we've done this face-to-face summit for years, and just connecting with all of you in person has just been amazing, electric. When we do it on the online, yes, we wave, we do whatever we do, but it's never the same. So for me, this has been really, really, an exciting space. But not only that, but the content, I felt like the content that we shared this year has also surpassed what we've been doing in the last a couple of years, especially virtually. Because sitting in a room, having young people speaking to you, doing actual practical, the workshops, I think for me were the best. But anyway, it's not for me to feedback, it's for, for all of you to let us know how you feel this summit has gone. So I have to represent our different audience. I have a panel here who I will introduce you to as soon as they come up. But what I really want to do is a little bit of an energizer, but that energizer is, I don't know if we still have any Portuguese speaking people in the room. Put your hand up. Yeah, so I have felt so sorry for the Portuguese speaking people while, when things happen and they can't take part. And I have recruited our country rep from Mozambique. He is going to, by the time we leave this room, everyone is going to be able to say, ready to end AIDS, doing it, you're all going to be able to say it in Portuguese. Wow. If you can't leave the room. So over to you, Dr. Eggers. Yeah.
Mais uma vez, boa tarde. Good afternoon, everyone. Para os que não falam português, por favor, podem colocar só alguns minutinhos o headphone, por favor. Então, vamos nos colocar de pé. Can we stand up, please? É um exercício simples.
I don't have the. No, it's fine. It's fine.
Are we ready? Are we ready? Estamos preparados? Então, o primeiro exercício, eu vou traduzir a palavra ready to end AIDS by 2030 in português. Então, o significado, the meaning is, preparados para acabar com o SIDA até 2030. Depois tem a segunda parte. A segunda parte, the second part is fazer bem, fazer juntos e fazer agora. Então, vamos repetir a primeira parte. Só repetiremos a primeira parte. Preparados para acabar o SIDA até 2030. Vamos repetir. Once again, mais uma vez. Preparados para acabar o SIDA até 2030. Preparados para acabar o SIDA até 2030. Fazer bem,
Bem,
fazer juntos,
fazer juntos,
fazer agora.
fazer agora.
Vamos repetir esta segunda parte. Fazer bem, fazer juntos
Fazer juntos,
e fazer agora.
fazer agora.
Ok. Agora vamos juntar tudo.
Uau!
Preparados para acabar
Preparados para acabar.
o SIDA até 2030.
Precisa
Fazer bem,
fazer bem,
fazer juntos,
fazer juntos,
fazer agora.
agora.
Preparados para acabar
Preparados para acabar.
o SIDA até 2030.
Precisa
Fazer bem,
fazer bem,
fazer juntos,
fazer juntos,
fazer agora.
fazer agora.
Are we ready?
We're done.
Ok. Vamos repetir apenas a última vez, mas vamos repetir bem. Última vez, mas vamos fazer bem. Certo? Preparados para acabar
Preparados para acabar.
o SIDA até 2030.
Precisa
Fazer bem,
fazer bem,
fazer juntos
fazer juntos.
e fazer agora. Palmas para nós. Espero que os colegas que falam apenas inglês, bom, tenham captado alguma coisa. Espero que tenham conseguido ficar com alguma coisa. Apenas repetir para solidificar. Preparados para acabar o SIDA até 2030. Fazer bem, fazer juntos e fazer agora. Isso é a mensagem que pelo menos temos que levar para casa. Obrigado.
Okay, thank you, Dr. Eggers. If before you leave, you can do this, there might be a prize. So yeah, keep practicing. So we will now, I'm going to turn to my panelists to get their reflections of what their takeaway has been over the last few days. And it's not just my panelists, it's all of you as well. I'm hoping that you've got your takeaways. Remember, in the opening session, Dr. Shafiq told us that he hopes that we will, each and every one of us will leave with a takeaway that they will go back and implement in their country. So we hope everyone has something to take away. So we'll hear from the panelists, but on your seat, there's a post-it pad, note, whatever color it is, it doesn't matter. I would like you to also write what you think was your real takeaway from this summit. One or two, we don't want lots, I know we've got lots, but just one or two, just so we can understand what has really, been exciting for you all. So the other announcement is that there is, with your post-it note, there are a couple of bags at the entrance. So as you leave, or if you want to do it now, you can go and put your post-it note once you've written what your takeaway is from the summit, because it'll be great to hear from everyone. And then the other announcement is that there's an evaluation form. So please do complete the evaluation form. Please be as honest as you can, because we would really like to hear how how the summit has been for you, and it will help us to improve future summit, whether it's content or the way we run it. It's all important. So please do let us know. So I'll now turn to my panelists. I will start with Grace. So Grace Ngulube is a very long time friend of PATA. How long? 10 years. Grace has been a friend of PATA for 10 years. Previously, she served as a chair of the board, chair of the Youth Advisory Panel, as well as being a member of the board. So Grace, we've heard quite a lot over the last few days Several interventions have been shared. And I want to try and, so could you share for us, representing other young people, what you heard that you think could be a game changer in improving service delivery or the experience of services that young people receive in our communities?
Great, thank you. Thank you very much. Okay, thank you very much, Agnes. And I really appreciate the opportunity. And I feel like this year's summit, it's been one of those summits where we talk about real issues. Yeah, we talk about, we were here not only to address challenges, but we were here to discuss solutions of the problems that we are facing as young people. As young people, we are complainers, but here we were solution makers. We were able to contribute towards change. And it was even good to see Dr. Shafiq mentioning about the gap that is there in terms of treatment for pediatrics. It's true, guys. If you look at pediatric treatment for HIV, it's very not child friendly. And I've been thinking of it, why don't we switch into advocating for an injectable drug for kids first before we go into the adulthood? Because we all say it's expensive for adults, but let's look at the kids. Prescribing these drugs to kids is really very hard. I've been there in the community and it's not easy. And loss to follow up is really not stupid. Mental health is real. As providers, as peer supporters, as advocates, as young people, we face so many mental health challenges, but we don't have that safe space because we take ourselves as models. Let's make sure we go for psychosocial counseling. We find someone who supports us. In our clinics, let's create that safe space. We need it as young people. And I believe that in my evaluation, in the next Sparta Summit, let's have the safe space where someone can be able to visit a psychosocial counselor for a mental health support. Stigma and discrimination is still an issue, despite talking about it. What can we do to change? What can we do to address what is causing the stigma? In our communities, people still have the misconceptions about HIV. We are here as advocates. We are here as people who are looking forward to the change that we want to see in 2030. But can we defeat HIV without defeating stigma? No. It's something that when we go to the community, let's make sure we address stigma and we fight against stigma. Our peer supporters, our young people, they need to be economically empowered if we want to use them as role models in the community. It's so frustrating to see someone who is a model and that into kind of a bad behavior. As a young person, I will not follow that person's advice. They are fond of getting into these kind of behaviors because they need support. They like finances to sustain their well-beings as young people. It's not all about me going to a facility and helping my fellow young person. What will I eat when I go back home? How will I wash my clothes if I don't have enough resources to support myself as a young person? We need to make sure that economic empowerment is clearly stated in our facilities. It's not all about you guys giving me money, but it's helping me find different innovative ways on how I can support myself economically. My fellow healthcare providers, let's make sure that we work with our peer supporters in collaboration. These young people, they are not there just as young people who supports their fellow young people. They are there as partners. Young people are partners, our partners. Let's work with them as healthcare providers, not as peer supporters. I understand they are not really qualified to provide different services, but they are qualified to help you on how best you can support a young person who needs a service at the facility. We also need to make sure that we listen to them and hear what are the challenges and solutions of different services that we provide in the facility. Sometimes some services are not youth-friendly. I can give an example. I'm not so sure if it's the same in other countries. We are fond of advocating for condom use. And how best are we supporting the use of female condoms? How best are we supporting the use of PrEP, PEP? Are these services really available in our communities? The issues of policies. In one of our cafes, we really stressed very well on policies. Our policies are really contradicting to each other. But as a healthcare provider, let's make sure that if we are at the facility, a young person is looking for a service, let's support them to access that service that they need. Thank you.
Oh, yeah. Yeah, so thank you, Grace, for highlighting all these critical, important areas that health providers we need to keep being reminded of. So I really appreciate doing that nice summary, and we will make sure that it comes up in our report that you really want us to reinforce those critical areas in terms of what creating enabling environments for adolescents. So and now I'm going to turn over to, I've got two health providers. I have Sister Neda Msonda, who is a healthcare provider at Charleston Clinic in Lusaka, Zambia. And Sister Neda is also a champion, and she describes herself as a champion with a heart for the children and for children and adolescents. So we've got the right champion. My second healthcare provider is Dr. Fofi Abdularam. Dr. Fofi is also a healthcare provider, medical doctor, practicing medical doctor, but is also a global community champion, Global Alliance community champion for children and adolescents. So two great champions here. So if I can start with you, Dr. Neda, please could you give me a highlight of something that you have taken away from this conference that is really excited you and that you think you can take back to your facility, to Lusaka, share with other health providers. And I know you and I talked about the 4 pillars of the Global Alliance, and you said you were very excited about some of the things that you've picked up. So if you could pick 1 or 2 things that you've picked up from the summit that you would like to share with us.
Thank you very much, Agnes. The highlight of your question is addressing me as Dr. Neda. Okay, great. Thank you so much. So my key highlights and takeaways from this summit. Firstly, I am so amazed to know that PATA cares for healthcare providers. And I know that PATA supports us. I was so smiling in the morning when I heard, when I was listening to Leslie giving her presentation about the feedback from what we had put together last year. And I said, I'm in the right place because I am being heard. So I feel my other takeaway for us, the healthcare providers, would be, guys, we are being valued in this place, aren't we? Okay. Yes. So let's also put in our best. Remember, we are all trying to end AIDS by 2030. And in doing that, it's going to take each and every one of us, our personal effort. It starts with you. I would like to speak to the pillar that I would like each and every healthcare provider in this room to heavily embrace. Pillar 4, the one that speaks to gender inequalities. Trust me, in as much as we'll try to play a blind eye to certain things, in as much as some of our policies in our own countries do not accept to certain things, but the fact is, we are in that era? Can we put aside all our personal beliefs? Can we embrace diversity as PATA has done so? As healthcare providers, we take an oath, don't we? To provide a service regardless of creed, color, race, or whatever denomination someone belongs to. We do take that oath. So let us not sideline the marginalized. Let us speak up. Let us show up. Let us be supportive. All of us, let's try to just embrace gender transformation. Let us be responsive to these needs of our colleagues so that together we can end AIDS by 2030. Let's provide a platform where everybody will feel free to walk through to a health facility and know that they are in the right place, meeting the right healthcare provider. Thank you so much.
Thank you, Sister Neda. I'm not even going to try and summarize because you've really encapsulated really well. And I do hope, I think one thing I do want to pick up on, I hope that everybody has also felt the love from the presentation that Leslie gave us, because I think I spoke to a few people who all really felt what Dr. Neda has shared. So thank you, Dr. Neda. Sorry, Sister Neda. Okay, so I'm going to turn to Dr. Fofi, and I'm going to ask you the same question, but I do know that you sit on the Global Alliance platforms, so you really have an opportunity to influence things at national level, district, as well as facility level. So could you speak to us about what your takeaway at any of from the summit that you might be able to go back home and try and influence change in Nigeria?
All right. Thank you, Agnes. I will start by saying that I'm just trying to give it a little picture of what captivated my heart in the course of this summit. In one of our cafes, one of the health workers stood up after watching a video, and she expressed something. She said, when she saw the teamwork, the various components, how things flow, service flow in a particular in the country, she stood up, she said, in my country, in my health facility, I do the data capturing, I measure the baby, the weight of the baby, I do the drug the dispensation of the drug, I do the recording all by myself. And I looked at that health worker, and coming to the meeting as the summit progress, I realized, just as my colleague have captured, that we, the health workers, we are the face of care. And if we are not cared for, we cannot offer that efficient, adequate care for the children we want to stand for. So I know in the Global Alliance, we focus on the 4 pillars, yes, which is something which is beautiful. But with this concept, I see palpable. You see people, you see every health worker is smiling. There's no way you tell somebody to go and take care of a child and he or she will not gladly go and do so, because he or she has realized that whatever he is doing, there's a focus on him as a health worker, strategically focused on you as a health worker, that your role is quite pivotal in achieving that ending AIDS in 2030. So what I'm taking back home is the fact that, yes, we want to talk about these children, we want to talk about the efforts we need to put, pillar 1, pillar 2, pillar 3, pillar 4, but these healthcare providers, they are the frontliners. We need to also focus on them. We need to talk about them. We need to encourage them, you know, and all that is something which is resonating with me. I feel that is the way forward. Then secondly, I just want to appreciate PATA to say that we trust you. What you've done has placed a trust in our hearts for PATA. That yes, it has placed a trust in our hearts for PATA. And then the enabling platform you give to us as health workers, for exchange of ideas, learning best practices, it has made me to see that, yes, in ending this AIDS in 2030, we can do it together, we can do it rightly, and we can do it now. It's possible. So that's the message I'm taking back home. And thank you for giving me this privilege to have to learn this. Thank you.
Thank you so much, Dr. Fofi. So my next question is going to be to our next panelist is a representative of Ministry of Health in Eswatini. While you might not be able to speak for all countries, but I'm hoping that your voice will be a voice at ministry level. And I'm going to put you on the spot because I'm going to ask you the question that we didn't, one of the question I'm going to ask you we didn't discuss before. So just listening to Dr. Fofi and Sister Neda, I'm hearing a lot about healthcare providers needing to be supported, needing to be cared for. What do you think? We've got all these ambitious global alliance plans in countries, which come with very little investment to implement. Do you think, or in your country, or do you think enough is being done to support healthcare providers for us to be able to reach our targets by 2030? Sorry, I know that wasn't the question that I planted for you, but.
Can you hear me? Okay, thank you very much. That's a tough question. Thank you, Agnes. Thank you, Pata, for this opportunity for us to meet as healthcare workers, because we're all healthcare workers here, to share our experiences. On the question on my table, healthcare workers are very essential from facility level, regional level, and national level. But I want to actually allude to the fact that I think as a government or ministry, we have not done enough. In the morning presentation, they talked about a healthy working environment enhances good mental health for our frontline workers. So it actually got me thinking that have we invested enough on their welfare, their self-care, their skills? I know we do a lot of trainings, but it is more focused on how to do the job, but not on how to make them like the job or to care for what they do. Is the environment conducive? Is, even if we had to even talk about remuneration, what encourages them? But if we get the results that we got from the research, we can see that there are some areas we need to work on. A lot can be done for them. If we focus on them, we ask, maybe do a suggestion box of what really would you want government or ministry to do for you? I know things are in place, but we can never say we have done enough for them because there's a lot. Caring for someone, one person, is a lot, and they have to do it every day. So we really need to take care of their psychosocial support and mental health, especially at the workplace. I think you heard Grace here saying, even in the next PATA summit, we need to have a psychologist in place so that if anything goes on, you are able to report, we are able to actually get the counseling that you need. So as government, I know in my country, we have actually done, we have a mental health program for healthcare workers, especially in the HIV program. So that is ongoing for healthcare workers, for debriefing sessions, for retreat. We have budgets for retreats and to make sure that we remember them, they are taken care of and they can breathe a little and, talk about their hard work experiences and lesson learned from the workplace. So, but the program, I know it has challenges of funding. We've talked about funding, especially even in the programs themselves. So it is not enough. We are helped by implementing partners to do those debriefing sessions. As the finances are shrinking, we are wondering, how are we going to sustain such a good activity that targets healthcare workers themselves? But we want to just assure that some of the things, sometimes they are not monetary. Wishing me a happy birthday on my birthday, it's something great from the workspace that I live in. Creating a good environment where I can express myself will actually make me more motivated. So now we need to outline all activities that we can do that are non-monetary so that we can sustain those, and those that need monetary, we can start advocating and budgeting for those things. But self-care, I think we've heard from this workshop or summit that it is very important. You cannot pour from an empty cup. You need to love what you do so that you can love the people that you are working with. From this session, I could see even the child-friendly faces. Please smile, guys. I need to see those faces because they give me hope that this is the face that you give to the children. And they are very sensitive. They always see that when you don't like me that much. So, but as healthcare workers, we need to be having these refresher sessions for us to keep motivated in the work that we do. It is hard, but I can see from the indicators and the presentations that were done here that we are actually trying, and nobody is patting us at the back, but PATA has done that so that we reflect on ourselves, on what we've done and what we can achieve. And I want to say, when we do it together and we do it right and we do it now, we can achieve it.
Thank you, Dr. Nobuhle, for sharing. I know you mentioned some of the interventions that you're doing in Eswatini, so maybe next summit, we'll invite you to come in and share with your colleague ministries of health, and hopefully they can also take that so we can continue to support healthcare providers in the work environment. So now I am going to turn to PATA's Senior Technical Advisor, Dr. Barbara Engelsman is our Senior Technical Advisor, and she is a physician. She has a master's in public health and has spent 20 years conceptualizing and implementing and supporting HIV programs in sub-Saharan Africa. So we're very lucky to have Barbara. So I wanted, because Barbara has been our BDI in terms of the technical space, trying to see what's coming up, what's missing, what do we need to think about. So Barbara wanted to hear from you. Is there anything that surprised you in this summit? Is there anything that was glaringly missing? Or is there, I know we've already been called out for the fact that we didn't include disability, nor AI, not enough on including artificial intelligence and also key pops. So already we've been called out on a few things. Are there other things reflecting from this summit that you think, we've missed? First of all, you can start with your reflections, but I would like you to speak to those specific questions. Thank you.
Thanks, Agnes, for the kind introduction. Well, actually, gaps really don't come to mind when I let the last 3 days pass review in my brain. I think we covered a lot of ground, no? Or is there a lot of energy left in the room? Ooh, okay. So from what I have heard, we covered different levels. We looked at political, societal, facility, community levels. We heard presentations from ministry level, from healthcare providers, from advocates. We covered the 4 pillars around VTP from different angles. We heard presentations, we walked through them in workshops, we engaged, we had research insights, we had implementation insights. It was actually quite exhaustive. We looked at testing, at prevention, at treatment, care, cross-cutting issues. and we had fun. So what else could you possibly wish for? Okay, so on a more serious note, so I felt like we looked a little bit in the past. So at times we touched on the evolution of programs, on the evolution of treatment guidelines and regimens, the journey many of us have been on for many years. The treatment regimens have simplified. We have less toxicity, less side effects. It's become easier. We're moving towards universal coverage. Remember, at one point, we only treated the most sick people. Then we are trying to treat all positive people. Now we are trying to get PrEP to the negative people. So the goalpost in my head is continuously shifting. This summit has been firmly in the here and now. We were trying to present different models to make it practical so that healthcare providers are feeling inspired and getting ideas of what to take home with. I think what perhaps I was a little bit missing was more sort of looking over that immediate horizon, because things are shifting all the time and are evolving. Perhaps we could have put a bit more emphasis on what is coming. We did touch on long-acting cabotegravir at times. There's other drugs coming with an even longer acting span, so like 6 months for the lenacapavir, for PrEP or as part of treatment. That's in phase 3 clinical trials, so that's coming. There's a dizzying spell array of new treatments and PrEPs and approaches that's out there, that's in different phases of development. And that's different ways of delivery, from vaginal film to rectal and vaginal inserts and gels. There is really hot on the horizon is the multi-purpose treatment, where we are combining antiretrovirals with, for example, hormonal treatment to cover family planning at the same time as preventing HIV, or combining preventing HIV and preventing other sexually transmitted diseases, herpes simplex virus, etc., like that. We haven't touched it all, and broadly neutralizing antibodies. Don't want to go into detail in it. It's just sort of this sneak peek over the horizon that is more is there, and the goalpost is shifting and hopefully helping us to move closer to our targets. But in all there is at the moment, and in all that is going to come, I just pulled out this quote, and in a way we covered this quote in one way or another, because it says the great aim of education is not knowledge, it is action. And that's you guys. Yeah, I'll finish with that.
Excellent. So thank you, Barbara. And yeah, that really sums up, the things that we missed and should have talked about. I know the presentation on Tuesday morning on innovations in adolescent health was meant to touch on some of those things, but I think because our presenter was virtual, she was traveling, we didn't quite make it. But yeah, I completely hear you. We need to be looking to the future and not trying to catch up. Mona Lisa reminded us yesterday that HIV, the way it looked in 2016, whatever, now it looks very different. So we need to keep looking ahead so we can keep up with what's coming to us. So what I can maybe commit to doing, because these things were missing on the on our agenda, is that we are going into our annual planning in the next 2 days. And I will commit to make sure that we schedule in the coming year in our work plan, we have something around all these new treatment innovations that are coming up and make sure that we share with health providers. So Dr. Barbara, you've got your job cut out for this year. So we'll make sure that we do something around that, either on our various platforms, our webinars, our linking and learning platform on the hub. And so, look out for an email around that. But the other thing I also wanted to say is, as well as what your feedback that you've given back, please go onto our linking and learning hub and please do give feedback, speak, have conversation. The conversation must not end now. Let's continue to have dialogue. And our linking and learning hub is a really good space for doing that. So we want to keep the momentum going. So on that note, I'm going to huge thank you to everyone, but we would like to invite our Executive Director, Luan, who you all know, to come and give us some closing remarks.
Great. So we are nearly at the end of our summit. So nearly there, but not quite. Just a few more announcements. But thank you hugely to our panel. So I'm just going to make the announcements first. That's the first thing we're going to do. And then I would like to ask all the PATA staff, anyone who's doing any support and work for PATA, please, if you could just come to the front. We want to just introduce you and thank you and acknowledge you. And then after that, we'll do a quick round and then we'll do our final PATA goodbye. But just in terms of announcements, please, on your way out, I'm sure that Zubair and Nuran, they're just outside. If you could please check your transfer times with them. So please, each one of you, make sure you know what time your transfer is going to arrive. If you are leaving super early in the morning, please ask the hotel for an early wake-up call, because otherwise they might end up calling Glynis, and she's not so friendly very early in the morning. Also, when you walk out, I think it's organized by name, first name, surname. It's organized by your first name. You can collect your certificate. But please, as you also walk out, put your little pink Post-its and your evaluation form into the bag. And for those of your colleagues, especially from Mozambique who had to leave early, you can do the evaluation form online on the Linking and Learning Hub, and then your certificate will automatically also be sent to you electronically. So if any of you want it electronically, you can also you can access it basically on the hub as well. Tonight, the dinner is in the restaurant. We were hoping to sort of have it at the pool, but they were worried a little bit about weather and potential of rain. So it's back here in the restaurant. I think that's pretty much just the announcements. So before I do a final thanks to you all, I just want to really thank the PATA team. I mean, all of you have been so generous and grateful and thankful. But just for me to really acknowledge this team and how much time and effort everyone puts into making this summit happen. And just that, you know, we don't have events organizers, we don't have external people. This is all done by the PATA team. So I'd really like the team, please, to come introduce yourselves, so that also, especially our team is growing in different countries. So I also want you to know who the country lead or technical support person is for PATA. I don't know why you're taking so long. I can see you.
Thank you for panelists before they leave. Yes. So as my panelists are leaving the stage, just say a huge thank you. You've been amazing. Please give a round of applause for my panelists. Thank you.
Helene's saying she doesn't want to introduce herself. Do you want people to introduce themselves? Yes, quickly, yes. Okay, very quickly, just your name, what your role is, and maybe country, because that's kind of helpful.
Is it on? Hi, everyone. I'm Abigail Dreyer, the head of Link, and I am based in Cape Town, South Africa.
Okay, I'm not going to repeat myself because if you didn't get it earlier on, then not now either.
Hi everyone, I am Isaiah. I am based in Mozambique.
Hi, everyone. I'm Angelita and I'm the communications manager.
Hi, I am Dr. Eggers, technical advisor, Mozambique.
Wakanda. Okay, thank you so much. My name is Wankum Simkonda, and I'm a field technical advisor from Zambia.
My name is Dr. Bako Henry. I'm program advisor from Nigeria.
My name is Paraman Moyo, Youth Advisory Coordinator and Communications Assistant from Zimbabwe.
Afternoon, everyone. My name is Dan Lord. I'm head of M&D based here in South Africa. Thank you.
Good afternoon, everyone. My name is Siboniso Lata, M&E manager based here in South Africa, Cape Town. Thank you.
Hi, everyone. My name is Telis Nyanomb. I'm a medical doctor, country representative based in Mozambique and currently supporting the READY program in Mozambique and Angola. Thank you.
Hi, everyone. I'm Dr. Fileuka Ngakongwa. I'm country representative in Tanzania. I'm leading the youth care as well as the Kulea project.
Afternoon, everybody. My name is Helene Suiters, and I am a senior programs manager at PATA.
Afternoon, everyone. My name is Kristen Koopman, and I am the admin staff or admin support at PATA.
Good afternoon. I'm Morgail. I'm from Cape Town, South Africa, and I am PATA's Finance and Grant Support Officer. Sorry, I didn't know you heard that. So I'm Epiphany from Cameroon. I'm a healthcare provider champion. I also coordinate the Breakthrough Partnership.
Hi, everybody. My name is Zubair Philander. We're from Travel Click and we did the logistics.
Good afternoon. My name is Jacqueline Mushi, technical advisor from Tanzania.
Good afternoon, everyone. My name is Dr. Kutsi Mlambo. I'm a senior programs manager at PATA and I'm from Eswatini. I'm based in Eswatini.
Hi, everyone. I'm Irenia Sambor, based in Tanzania. I'm field technical advisor for Kulea project.
Hello, I'm Puri Gonzalez, technical advisor, Mozambique.
Hi, I'm Nuran from Travel Click and Travel Support.
Hi, everyone. Tabisa Seleka Makreteva, South African country rep and also country lead for Hive, and I'm the host.
Hello, I'm Dr. Elang Margaret, country rep, Uganda / senior program manager on the Breakthrough Partnership project.
Uh, uh, Hi, everyone. My name is Margaret Mbugwa. I am from 254. Kenya. I'm now a technical advisor under the Youth Care Project. Hello, everyone. Are we ready? So I'm the ready one. I am Dr. Vanessa Fozaombi, country representative for PATA Cameroon. Thank you.
Hi, everyone. Good, you look nice. Okay, yeah, my name is Akas Komuvanga. I am the PATA rep for Zambia, but I also support about 3 projects in 5 countries. Thank you.
Hi. Yeah, my name is Tabang Masangane from Eswatini, country representatives for Ready.
Afternoon, everyone. My name is Aweneni. I represent PATA in Zimbabwe. And I'm sure the reason why they stood up is because I'm currently also representing the SADC chair. And as you plan for the festive season, I also want to welcome you to our wonderful Victoria Falls. You have the better and the best view from the Zimbabwean side.
Good afternoon, everyone. My name is Dr. Ellen Ekanem. I'm the country lead for Hive Project in Nigeria.
Hi, everyone. I am Guy, the IT guy.
Hi, everyone. I'm Glynis, and I'm the operations and logistics.
Okay.
Hey? Oh, I'm the dollar lady.
Wonderful. Is this on? Now we know who's most loved at PATA. Eh? Yeah, very, very telling. But really to this remarkable team, a huge thank you. Also a huge thank you to our partners and our sponsors who help make all this work happen. Just to also alert them, not everyone's here works for PATA 100% of the time. We sadly don't have that huge a budget. But really as an organization, just the remarkable growth over the last few years. But really nothing would happen without such an incredible team. So viva PATA, viva. Viva! And viva frontline healthcare workers, viva. Viva! Viva frontline healthcare providers, viva. Okay, so here's a PATA song. Please travel home safe. Thank you so much for everything you do.
Give the children. Bada bada, bada bada, bada bada. We give the children. Bada bada, bada bada, bada bada. We give the. Bada bada, bada bada. We came for this. Bada bada. Bada, bada. Yay, 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 yay. Woo! Bada, bada. Woo! Bada, bada. Okay. You. Woo! Bada, bada. Yeah. Bada, bada. We give. Woo! Bada, bada, we give for the children. Woo! Woo! Bada, bada. Woo! For the children. Bada, sir. Bada, bada. Bada, bada, we give. Woo! Bada, bada. Hey, bada, we give children. Bada, bada. Bada, bada. Bada, bada. We care for the children. Yeah, bada, bada. Woo, 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 woo. Bada, bada. Care for the children. Woo. Yeah, bada, woo. Bada, we care for the children.
Butter, butter. Butter, butter. Butter, butter. We care for the children.
Pata pata, we care for the children.